Yes.
Can you increase the volume?
Mine is at full volume.
Yeah. Can you hear now?
Yes.
Okay. Thank you. So, while we are expecting few more colleagues to join our, an important topic while we are moving into the week 2 of COP16, and it has been challenging to fill the space of participants trying to learn topics like a gray area, like what we are going to speak today on understanding the impact between the drought and the human health. And we have put together a series of experts to speak today from the crop systems, human health, and also from the technological focus of what is the relevance of monitoring to predictions to indicators, as well as evaluating the impact of malnutrition. We have built this work building on a couple of years of our study in Senegal, understanding the linkages between the nutritional survey data and the earth observation indicators. And what we would do is a quick short presentation from myself and Jesse first, and then we can ask the intervention from Dr. Rao, and then we can have a small interaction among the people, right? I hope by that time we will have more participants who would like to learn. Uh, Can I see the presentation? Yeah. So I'll be very brief, just summarize, as there are people joining in online as well. So one of the limitations of a lot of time we talk about nutrition data comes from the survey. And what we are trying to do is how do we build early warning capabilities to early action using the earth observation data here. Or the second slide. Is it the first slide? So, I mean, this is a recent data on the precipitation and linking to production losses. It's very much clear that when good rainfall, we see the production is very good. And many of the rainfed systems in around the world, if rainfall fails, we can clearly see there is security that will lead to malnutrition and related livelihood challenges. Um, it is also very clear climate have profound impact on child malnutrition here. The studies that shows from FAO that it is going to increase by 2050 when we talk about child malnutrition. Now, in terms of what were our mitigation measures going forward here? So one of the areas we look at is earth observation as a huge potential for assessing the drought, and we see a landscape of satellite observation available to monitor different spaces. We have different products available from 10-meter resolution to 1 kilometer freely available data. This can inform timely action when it comes to crop production losses, damages due to floods, or any other disasters. So this is a important open access earth observation. And it is also very clear that these information or assessing impact to health or like look at child, you have different data products, as I said, but you can prepare these knowledge products into different response factor, right? So for preparedness, protection of asset, as well as providing livelihood, you need to have these capability put in place, not just depending on, the post drought, assessing the survey and then quantifying how different household level nutritional impact is going to be defined. This is where the drought monitoring, early warning, as well as early action infrastructures are the need of the hour to look at platform. So I just want to start with an three important perspective here. One is we need to have a clear understanding between the drought and the malnutrition. So one of the impact we can start with the earth observation and the ground observation is to know where there is a reduction in crop yield and also where the regions are going into drier due to water scarcity in the rainfed systems. So once that quantification is done, then you can bring into household survey, look at where there is economic access, because farmers or any vulnerable population may not have access to buy good food, whether it is a fish, whether it is vegetables. The problem is that they may not harvest a maize crop. If they don't buy that harvested crops, they may not able to go into dietary diversification on that. So this particular part is very, very critical when we talk about pathway to malnutrition. The other part is when we talk about this, we need to have a targeted vulnerable population to be identified, either in the agrarian system, specifically reaching out to women, children, and youth. And that's again ground data. There are a lot of digital innovations are available to capture that at a field level. So we need to integrate this kind of holistic thinking when we talk about potentials of earth observation as well as assessing the malnutrition, which is basically comes from a household survey perception. So we try to build this evidence in a case study in Senegal in collaboration Ministry of Health and Sanitation Department in Senegal. And it's quite a complex weather pattern, as you see in this slide. The more in the southern, when you go, quite a bit rain, and in the north, you don't have much rainfall. And again, what is more important is the drier systems will have a lot more impact when it comes to malnutrition. So what we did was we collected all this data processing method, and analyzed using a remote sensing observation, and a statistical method was developed using a R tool, and we have handed over that capacity building program through that. The tools have been handed over. So one is we have used a composite drought, what is called integrated drought severity index. We have understood where the spread of drought is there in different part of the year, including the last year drought, where we have seen El Nino has really a widespread impact across the Africa. And then we have quickly understood the severity of the drought, looking at the long term, where the regions experience regular drought. And then we come with a clear understanding of linking the monitoring indicators like rainfall, vegetation index, and the crop yield with the census data in terms of the percentage of stunting, underweight, and wasting. So this is purely coming from the ground data provided by the government itself. Now, what we did was we related in terms of food insecurity and the state of poverty in the data provided by to us, and we can clearly see poverty level and the malnutrition goes 1-in-1. And this is the region as well. It's prone to regular drought and frequent severity of the drought. So there is a quite a linkages between assessing your precipitation impact to poverty as well as to the food insecurity. Then we use the statistical method and try to quantify the regions like St. Louis, parts of southern Senegal are prone to acute malnutrition. And there are also region has a short lag term because there is a too rainy season. So it can recover in some of the region, but not in all the region. And then this kind of a knowledge can be used by the health department to have timely intervention using seasonal forecast, like agencies like ANASEM works a lot on that. So the summary for us is taking the survey data, taking the remote sensing, we can really quantify. And the advantage of that, this is the data coming from the ground observation. What we want to do is using the meteorological forecast as well as the satellite data, they can prepare at least 6 to 9 months in advance. You know, these regions are prone to malnutrition. What can we do much in advance? Preparing preparedness to health risk, preparedness to crop yield, providing food safety net, providing insurance program, all broadly also improving the watershed program to access to water scarcity, etc. So there is a lot of drought mitigation efforts we can bring in here by bringing capabilities from a wide range of open source knowledge products. So, I mean, my remarks is that agriculture is a very challenging focus that can be linked to malnutrition because farmers' dependency on rainfall is very, very critical. And the second aspect is that we need to promote more efficient irrigation in those. At least part of the region have to be converted into minor irrigation program, water storage, soil conservation measures. These are very, very critical. And also talk about, I have seen excellent work in Sri Lanka talking about, enhancing dietary diversification. So the government has a meal program that talks about how children have to eat different pulses, vegetables, fish, etc. I think that's a very critical area. How the assessment what we brought in is very important. And also people, this is like a, it is not visible, the nutritional impact, but over a period of 10 to 15 years we can really evaluate. Children are getting more stunting and wasting, and it cannot be just quantified by one severe drought even. I just want to highlight, and we have submitted this paper and just waiting for the final review process of that. So I'll stop here. Thank you again for giving this opportunity. So over to Jesse to provide your.
Well, since it's a fairly small room. Okay, since it's a fairly small room, I can probably just cover a couple of the key points. Is that the ticker? Oh, there are people online. Okay, well, never mind. Then I'll go through the entire presentation. Thank you for making me aware of that. So I'm Jesse Bell. I'm at the University of Nebraska Medical Center. I'm also just more broadly at the University of Nebraska-Lincoln, and I'm a director within the Doherty Water for Food Global Institute that runs across the University of Nebraska system. And so I'm going to talk about how drought can lead to health impacts, but in particular, kind of start off talking about that relationship with malnutrition, famine, and then go into the broader impacts of drought. So when we talk about drought, I always love to put this quote up here at the very beginning. Floods kill people, but droughts destroy civilizations. Floods are very impactful. You can see the impacts of floods, but there are numerous droughts that you can look back through in history and identify the collapse of civilizations around the time that major drought events occurred in those regions. And that just speaks to the magnitude of drought events and how insignificant they are. But I would also say that droughts result in adverse human health impacts and in death in particular. I became interested in the health impacts associated with drought. This was over 10 years ago. We were working on, there was the 2011 drought that was hitting the United States. It was a very large, impactful drought in the southern part of the US, but also in northern Mexico. And colleagues of mine, well, we were having an international meeting. We were talking to colleagues in Mexico, climatologists there. And they said, you guys are talking about cows and livestock dying. We're talking about people dying. And that made me start to think about drought in a slightly different way, but also make me think about, well, what are the impacts on health here or in the United States? And so from there, we started to better investigate drought and looking at its impacts on human health. I'm going to talk a little bit just more broadly about drought and how it's impacted human health over the last century or so. So this is from MDAT data out of the international database that's in Belgium. We calculated all of the different deaths associated with different disasters. Drought has likely impacted more people than almost any other climate or weather related event, but it's also resulted in potentially the most number of deaths as well. And that's primarily due to famine and malnutrition internationally since 1960 to near present. And so with famine and malnutrition, there's multiple different pathways to adverse impacts through drought. One, reduction of yield. Through a reduction of yield, there's less caloric intake, there's less food production, and then there's also less diverse food options, which all these can have negative impacts on human health. You can also see higher food prices, which then makes people go towards cheaper food options, and cheaper food options is less nutritious foods as well. Decline in livestock health, loss of protein, and even potential migration of populations to new regions for especially pastoralists that are looking for places to graze their cattle, which can also lead to conflict, which can lead to famine and malnutrition within those populations as well. Food insecurity, just by definition of itself, micronutrient deficiencies, malnutrition, stunting that can all arise with just general food insecurity. Decrease in water availability, but also decrease in water quality. And so that can potentially impact food preparation and disease transmission. And then the impacts on local food systems, smallholder farms especially, and local markets being closed down because of drought events, which then can lead to food insecurity issues as well. And with any of these, and one of the things I always talk about in the context of drought, in the context of the impacts that we see, are health outcomes. At the end, one of the reasons we're interested in any of these different pathways is because it can lead to an adverse human health outcome, either stunting, malnutrition, but then also a variety of other health outcomes that I'm going to talk about here in just a little bit. But when we talk about drought, it's very difficult to understand the health impacts. Droughts evolve slowly. They're not like other natural disasters or other climate weather related disasters that happen more immediate. And you can see the impacts immediately. These take longer to manifest, which means that they require multiple steps before you see human health outcomes. And we're not really easily designed in epidemiology to understand these relationships. But they are there. Here's a number of news articles talking about all the different ways that drought can potentially be related back to human health outcomes. And as you can see, these are from around the world and just in like about a 2-year time span. Because at the end of the day, drought is a threat multiplier. Drought reminds me a lot of climate change. Drought changes the environment around us. With that change in the environment around us, there are potential adverse human health outcomes. Drought is associated with more extreme heat events. Drought can be associated with conditions that can lead to wildfires, reduction of water quality, water quantity. It can lead to reduction in air quality. And we can also see the spread of disease. And there's a number of different pathways for that. And so this figure just illustrates some of those pathways and how we get from the change in the environment that drought can express to adverse human health outcomes. And so here in the middle, that center blue circle is the ways that drought manifests: higher temperatures, lower precipitation, lower snowpack, reduction in runoff, reduction in water, groundwater. Those things can impact the environment in a variety of different ways, including vector-borne disease or insects and pathogens and where they live, to water quality and quantity issues, reduction or increase in heat waves, wildfires, dust storms, and food and agricultural security issues. And each of those, like I was mentioning, can lead to an adverse human health outcome. Obviously, one of the things that we're very interested in is famine and malnutrition. But you can also see these compounding issues that happen within a society when a drought event occurs. So not only is there famine and malnutrition, but reduction in air quality can cause respiratory health outcomes. You can see allergies, you can see heat-related illness. We know heat waves likely kill more people than any other climate or weather-related disaster today. And so with that, there are certain populations that are more impacted. And in particular, rural areas and farm workers are more impacted. And that's through all those different exposures that they can experience. And so one of the things that we've been working on is how to connect these dots. We're doing research to better understand some of these relationships. We've done a lot of research in the United States. We've seen an increase in stress in farmers. We've seen an increase in suicide rates in farmers as well. We've seen an increase in cardiovascular related mortality, respiratory related mortality, all associated with drought events. And so what we've done is trying to do engagement with local and state at the local and state level to understand what are the needs, what are the what's the current capacity, what's the current understanding, and what are those gaps in all those different areas to understand what local health departments and state health departments need in the United States. Through that, we worked with the National Integrated Drought Information System within the National Oceanic and Atmospheric Administration in the US government to develop a nationwide strategy on how to integrate drought into public health action and planning. And then from that, we've been able to create tools and resources for local public health departments to be able to enact on some of these issues. And so this, for me, is where I would like to see a lot more work taking place on being able to understand the health impacts, but also coming up with tools and resources at the ground level to be able to address these issues. So drought is unique to other climate-related disasters. Drought is often overlooked, and the health impacts are very significant. A lot of these things extend beyond famine, but famine is obviously, and malnutrition is incredibly important. We need to make sure that we're working with local actors on the ground to develop resources for their needs that fits their needs. And we need to make sure that we're continuing to do research to better understand all the different gaps and understanding of how drought is impacting human health and what are those pathways. And so with that, I want to thank our funders. And if you have any questions, please don't hesitate to reach out.
Are there any questions in the online? So far, no. You have a question?
So the question I have for both of you really is how do you say that this stunting, this malnutrition, this whatever it might be, is a result of drought? Or it's often quite hard to just say this one single factor has led to this. How do you and we know that it's sense that it makes it, but what percentage is because of the drought and what percentage of it is because of that other thing?
That's a great question. I don't know if I have a perfect answer for that one, because it is a lot of teasing out of when you're looking at some of these epidemiological studies, and stunting and malnutrition, and a lot of these things can take a long time to manifest. But it is a compounding factor that could potentially impact, especially at certain times in a child's development. And so there's still more work that I believe that needs to be done to better understand some of these relationships. But with any change in food security and food availability, and like I was talking about, there's multiple different pathways within there. And so it's hard to say that it's drought can be the underlying factor, but then it could be, and this is where we need to better understand some of those different pathways. Is it a lack of food availability, or is it, disease? Or is it other factors? And a lot of times it's compounding, right? If you're in a place where you're seeing stunting, you're also seeing water quality issues. Drought can potentially impact and further expand on water quality issues that you face. And so that's where, I kind of go back to it being a threat multiplier. It's one of the factors, but we still need to understand all the potential factors as well. So that's the best I could give.
No, but just to have response. Just to add here, I think one of the other direct impact we have seen is rainfall deficit, crop yield losses, job and income. If we combine that, we can directly see at a household level, the stunting and wasting is emerging very, very clear. Because too rainy season, household level, no income, and they cannot afford to get a diet, a nutrition level of income. So those four factors I feel is also very critical to define household level nutritional impact.
Yeah.
You want?
Thank you. This is really great. My name is Sausan Gharaibe. I'm AMI's regional gender researcher for the Middle East and North Africa. So in other programs, we're looking at the effect and the linkages with gender-based violence. Have you come across instances of gender-based violence, intimate partner violence, violence against children in relation to drought?
Yeah, I mean, children and women are definitely two of the most at-risk populations when we're talking about potential drought impacts. Whether it's for adverse human health outcomes, we've done work where we've seen an increase in mortality rates associated with respiratory related mortality, cardiovascular related mortality in the United States, and women were the more impacted population. But we've also done work that hasn't been published yet, where we saw in the US, men are more likely to die by suicide than women. But when we looked at drought events, especially in rural populations, women were more impacted. So we saw a more statistically significant increase in women-related suicides during drought events. And we think that it's a trickle down, right? There's more stress in the household. And sometimes, unfortunately, women are the ones that, men don't have like all the coping mechanisms that are necessary to be able to address some of those issues. And so that starts to pull in some of those pictures. My mom was a nurse when I grew up, and she was talking about whenever a drought event occurred or any kind of natural or climate or economic related disaster, they saw more spousal abuse. They saw more, drug and alcohol abuse within the household. And they also saw more self-harm. And so I think, there's anecdotal evidence, but there's also a lot of other evidence on those relationships.
And the question was exactly following on from that. Is there any data I mean, always hear about suicides of Indian farmers during failures of all of that. And I was speaking to somebody here who's, it's an Abu Dhabi organization about mental health. And we were asking for, do they have any data from the region here? And I think it's and it's quite hard to say, it is the straw that breaks the camel's back, etc. There's a whole lot of, might be farm debt or many other things, but I think it's a really important area. We saw in the Middle East, you get increased polygamy, you get women's lot is much, in many different ways becomes much harder during droughts, isn't it? We see that.
Yeah, no, I completely agree. I think this is something that we need to pay more attention to, because a lot of times when we look at it from one lens. We did a study where we looked at farm workers and farmers, and it was focused primarily on male population. But we didn't do a study and an evaluation. A lot of people haven't done studies and evaluation, especially looking at what are those impacts on children? What are those impacts on women? And I think this is a major gap in our knowledge and understanding. We need to do more work to better evaluate what are some of those, gender-based related issues.
Yeah. No, I think this is a very important topic, and we were particularly addressing it in the Climber program in Zambia, where we have seen during the drought how women have to travel at least 500 to 800 meter distance, and they have to do a lot of dug holes to collect some water, and the fuel, there is no energy available. So gender violence is a big focus in drought related direct impact, but this is something where data is really a gray area to focus on. Most of the time it's a qualitative perception, not really a quantitative. That is where the survey data would help us. But it's a long way to look at this focus on that. So we set up there a solar borehole dedicated for women. So they can get 24/7 drinking water, water for domestic use, water for home gardening, water for livestock. So the women are the champions there. They were once a drought affected, marginalized group. Now they are championing, So that's a success story we can share with you. So with that, I just want to ask now two experts we have, one joining online. Dr. Rao, you can hear us?
Yes.
Dr. Rao?
Yes, I'm able to hear you.
Hello, Dr. Rao.
Are you able to hear me?
Yeah, now I can hear you. Thank you. Thank you again for appearing to this COP16. Really appreciate your support here. Because you are representing Indian Council of Agriculture Research, I just want to give a very focused question on, based on your own experience in India, what innovative strategies the ICR have shown. You might have seen our presentation on drought and human health. How do you see from the agriculture system point of view, this can be mitigated, because it all comes with crop diversification in dry land regions. So could you just highlight your intervention, what ICR is doing broadly? Thank you.
Sure. Thank you. Thank you, Dr. Giri. I think the drought-prone regions in India, which are relatively located in semi-arid and arid regions, have a widespread spectrum of crops, which includes millets, which are grown with a very less amount of rainfall, having less water footprint, and these are traditionally grown also. And now again, with the nutritive values and with the value-added products that are being put together for these millets, there is a tremendous focus being given by the government. So when we look at the small farmers in the dryland areas, which are often having the droughts, and obviously growing them would be more economical. And not only growing, I think there is a need to support them in terms of price support, etc., and making them available to a larger population whenever the drought happens. And those are the ones which are taken. And for example, in India, we have about the millets are grown. These are called nutritious cereals, we call them. And these are grown in about 13.1 million hectares. And our national production from these 13.1 million hectares is about 17.5 million tons. And good number of states which are having low rainfall in the central India, eastern, western India, and in the southern India, they are growing this. And the government mostly focuses on promotion of these crops for more nutritive values, and we call them Shri Anna cereals. And if you remember, this was the International Year for Millets 23-24, which has been at the instance of India that has been taken up. And one more thing is, whenever there is a deficient monsoon happens, whenever there is a delay in the monsoon happens, normally these are also considered as to be grown as an alternative for some of the food crops like rice, etc. And with the health that is being everybody is considering, and there is a good amount of the interest shown by the companies also in terms of producing the value-added products, and that's how this is being increasingly there is a demand, and the demand is such that even the farmers get more than the minimum support price advertised by the government also. Thank you.
Just to follow up, you mentioned about a specific crop like millet, there are, but what about from the point of children's when we talk about, drought and its impact? Because at the end of the day, if there is a production loss, farmers' income is going to go down season by season. And then is there any specific policies that look at, the more diversification, fruits, vegetables, etc.? Because you've spoken only the major monocrop like millet.
Okay, millets are not one crop. There are good number of crops. There are a diversity of crops. For example, like sorghum, bajra, which we call finger millet, pearl millet, kodo millet, little millets, and there are many crops like that. And these are some of the states are having a particular millets being grown. And there is one of the biggest government program that is going on is the something called National Scheme on Midday Meal Scheme for the children. And all children up to the class of 8th, who are those from the primary classes, they are being provided midday meal scheme, and they are covered in that. That is about 11 crore people, children are covered in this particular scheme. And in addition to these cereals, there are also additional material being given like milk, etc. in this particular scheme. That is one way providing the overall nutrition to the school children. And this also to disengage them from entering into a child labor and also attract them so that they would get into the education, formal education from early stages. And this is one particular program is being on at the national level. And another one is, as I said, the government promotes in terms of giving the minimum support price. Minimum support price is one wherein a farmer has to get that particular amount of income per hectare, whatever the production they have. So majority of the time, what we have seen is in the millets, the MSP is whatever the price being realized by the farmers is higher than the MSP because of many interventions. For example, like value-added products, and some of these straw, etc. for these are also used by the livestock during the dry seasons. And there are particular states which have got their own programs also. For example, like Orissa, which is in the eastern part and having a high rainfall and traditionally rice growing region. But now they are also shifting to the millets. The government is procuring and distributing among farmers. Similarly, Karnataka, which is traditionally growing the finger millet, they are also having a particular program to cover them in addition to the government, national government, whatever the support this gives it. So they have a large emphasis from the policy side to grow these crops in terms of for the health consciousness and also to distribute them. There is a scheme called public distribution scheme. And in this one, if family is giving certain amount of food grains every month, and this is also part of it, every month that would be given, procured by the government and distributed by the government. And the women self-help groups, the farmer producer organizations are encouraged to procure and give it to the government instead of farmers themselves going in. So that way the farmer producer organizations also get strengthened financially. The women self-help groups also work in that way, and they get certain amount of support for procuring this. And then the government procures and distributes it across on a larger area, across states. So this is how it happens. I think this is one way the policies are helping to do the, in terms of reducing the malnutrition among people.
Thank you, Dr. Rao, for that very insightful, understanding the policy linkages to the cross-sectoral program and making sure that the human health is not impacted, specifically the children. Thank you so much for joining us from Hyderabad. With that, I just want to invite now Dr. Peter Bellenti from the Jamel Observatory, and also having another hat with ILRI as a consultant. I just want you to get heard about, or we want to hear specifically from you on, you have seen these two presentation and also from the crop system, what generally they are handling when it comes to human health. We want to know how these kind of knowledge products are generally used in your observatory to look at nutritional outcomes per se. Over to you.
Okay, thank you very much. I'm Peter Ballantyne. Yes, I'm working for the Jameel Observatory for Food Security Early Action. And let me just very briefly, this is a kind of a relatively young initiative set up by the community Jameel about 4 years ago. We work, it's with the CGIAR. We work with ILRI, the International Livestock Research Institute, with Save the Children International and UK, especially in Kenya. And we work with JPAL, the Poverty Action Lab. So it's ILRI and the University of Edinburgh. So the idea is somehow to bring the academic, the applied research, the humanitarian piece, the rigorous evaluation all together into one initiative. So I'm not an expert on nutrition or malnutrition. I kind of do the engagement for the observatory. So, but what I want to do is maybe share a couple of pieces of work that our partners have been doing. So just recently with Save the Children, when we first met them, they talked about forecast-based action. And then it's evolved into now anticipatory action. And this has become the big kind of leitmotif of the humanitarian space. And they did a kind of a recent piece of research in Somaliland and Kenya, northern Kenya. And we worked very much with drylands, with pastoral areas, pastoral regions. And basically they were trying to assess the response. We had many years of protracted drought. We have communities that are very much based around livestock. So basically, they were looking at the coping strategies where anticipatory action could have a difference. So what I want to do is really quickly share, what they discovered, some of their coping strategies to migrate. The people migrate, but especially the animals migrate. So you move away, yeah? You have to buy fodder. You have to spend more money because you have to feed your animals. You have to buy water because there isn't water. You have to truck water in, or you have to dig. You have to expend money there. You sell your animals, perhaps. And one of the interesting things was they say that the households changed their food consumption patterns. They less nutritious, less diverse, less expensive, whatever, that all changes. And because this was Save the Children, they very much focused on what does this mean for the children and the mothers. And what they said was what we're seeing is that the children are at greater risk of malnutrition because of these less rich, less diverse diets. Because the animals are migrating, that means that the source of milk and meat is also moving, and very often the children, when the mothers are left behind, so their diets are changing, and very often children are pulled out of school. Now that might not be a physiological health hazard, but it may stunt your. Very often, when the droughts are long term, they don't ever go back. So you could argue there's a health effect there. So that's just one of the pieces there. And what they've identified was what are some of the promising things you can do about these things. They talked about school feeding is really important intervention, food assistance, providing cash so that people can buy the water and the feed. So that was that whole kind of, you can see there the nutritional risks and perceptions. But what also came up very much is that we have also a group of people looking at, you talked about kind of a drought intensities. And when is a drought? And very often we scientists maybe measure it and say, you have a drought. But sometimes when the communities themselves, they don't perceive themselves yet to be in a drought. Yeah, so there's quite a kind of so there's all this conversation about triggers. When does action take place? What type of action? Who is it for? And which evidence do we use to trigger? Is it that their triggers are different to our triggers? So that's just one kind of perspective. I got one other quick piece you were also saying about, okay, so we've just launched a new small project together with the University of California, Davis, and Kenya's National Drought Management Authority. And basically, as part of their drought monitoring, they collect, they have sentinel sites all over dryland Kenya, and they collect information about the nutritional status of under 5 children. And they do this regularly all over the place, but they haven't been able to turn this into forecasting. So together with UCD, they've now identified a way where they think they can use some Earth observation data together with artificial intelligence and this monitoring, and they can turn this into some forecasts where NDMA can begin to offer kind of nutritional based warnings and forecasts, but for specific audiences. So that's just a couple of things that we're working on. I don't know how they particularly answer the piece, but anyway, that's kind of there. But I think this challenge is, when is a drought? That's really a critical thing in a way.
I have one more follow-up
Okay,
question
sure.
for you. I think this is a very interesting impact of partners you are working with, Save the Children like that. We are also working with the National Drought Management Authority in Kenya, World Food Program, as well as a series of Red Cross Center as well in Kenya. You touched upon this anticipatory action, right? Generally, still the anticipatory action is more towards agriculture systems, broadly using the seasonal weather pattern and then link that to when to grow or what type of grow. Now, this topic is more towards malnutrition, and which is not visible through our seasonal forecast. Now, how do you see this early warning? You know, there is a global mission on early warning for all now, and every country should have early warning information. Now, how do you see the anticipatory action which is emerging and directly linked with the nutrition? You touched upon already, you know, the indicators that defined from the examples from Save the Children, but what else we should do going forward on this?
Couple of things. Well, these are things I've learned from my colleagues. I'm not the expert on this. I mean, so when we work with Save the Children, well, firstly, the people in Somalia and Kenya who did this study, they don't really make great use of the formal early warning system. They don't really trust a lot of it. So there's a big question about whether that early warning is getting to those places. When we spoke to Save the Children, they said all this data is great, but we need to be able to identify the likely impacts and when they will take place and who is most vulnerable. And that isn't something that you get. You get kind of like physiological changes that are expected, but what does it mean for different groups? That's a very big challenge. And so how do you kind of bring in that impacted piece and localize it? And the third thing is a colleague of mine, he's really worried that all this anticipatory action is very great for sedentary people. But as soon as you're a migrating mobile people, you get a warning that you're going to have they move around. It's quite different. So we need something quite different for mobile communities with mobile assets. I don't have an answer for that, but there's some research there. There's some really interesting work to be done about who's really impacted, and then how we translate all these wonderful warnings into actions and outcomes.
Thank you, Peter, for that. I just want to give the floor to Rachel. Listening from all of us, from 4 of us, we didn't add the speaker from ICRISAT, but I just want to see what is your call for action, around this field, while we are also championing CGIAR-wide drought action catalyst. So what should be the way forward? Thank you.
Okay, so to me, what I'm seeing is we need to join the dots up. We've got lots of really important bits of information. There isn't an awful lot on drought and health. I know Jesse's, internationally is seen to be one of the great leads, but we're not joining the dots up. So to me, is what can we take from this is, well, the CGIAR is bringing, we just stepped outside because Jesse was talking to the Saudi government yesterday, and they are looking for something that maybe we can come together. So to me, is how do we join these dots up? How do we join up? We were talking about FuseNet, and there are some various observatories, but they're global data, not always trusted to, if you're going to trigger actions at a local level, your government has got to be able to trust it. So how do we build this together? How do we bring in Save the Children and World Food Program and UNICEF, those humanitarian organizations, and link them through to development organizations, which is probably what more that we are when we're looking at the long-term parts of it. So school feeding absolutely is critical. And we know WFP are very, very good at that. But we also need to help longer term drought resilience and those actions like that, and understanding the full complexity of drought and health. So I think in many ways, this session is triggering a call to come together under this, in this space, and the interventions from Dr. R from India, there just isn't enough on that. And I think the Jamil Observatory is really important idea. And how can we then expand that and build on that? How can we build in the insight that Jesse brings, you know, for where it's a much richer data source of those impacts on droughts? And yes, some of it's, a lot of it's in the global north, but in many ways, those same impacts are felt just differently, the extent.
Yeah, absolutely. That is, thank you, Rachel, on that. I think from our own discussion here, we see health, I mean, drought itself is a more reactive approach, and health is far more reactive. You know, it is, since I said in the beginning that the stunting and wasting is very much not visible in few months from now. It takes 2 to 3 years to see that from the survey data. Often the survey data comes once in 5 years. In my country, the national survey happens once in 10 years. I don't know in UK or other places. So understanding this social vulnerability data is very, very critical. I think that's where modern data, you know, today everybody use smartphone. We capture a lot of digital footprints of retina, thumb, and then we can really look at a seasonal outlook and the children's which are living in that household in arid region. We can look some technological elements to that. Otherwise, the traditional survey data is not going to make any big significant things around that. Yeah. So, want to say something?
Well, and I think that's also one of the areas where we need to make sure that we're making investment, is making sure that healthcare, public health, health ministries are at the table. Because a lot of times when we have drought conversations, it's on, you know, they're not always the ones that are brought in. It's the planning and preparedness from, you know, drought managers, water managers, agricultural sector, which all are linking back into human health. And so making sure that those sectors are coming there to the table, and then they understand the importance of this. Because getting access to some of those data are going to be what allows us to actually understand these impacts. They have access to the data, and they're the ones that are also developing the systems as well for monitoring. And that could be at the hospital level, the clinic level. That allows us to get better understanding of what's going on at the ground. And that also helps us being able to figure out how to make tools for those individuals. So yeah, that's, I think there's a multiple faceted
Exactly.
way of addressing this issue.
Peter, you want to say something?
Just super quick. In another part of my job, I facilitate meetings and workshops, and I did some work recently with the World Association of Animal Health, which has changed WOA, who had a project together with Interpol and FAO looking at animal health security. And they came up with a model kind of like, you know, you need to plan, prepare, respond, recover. And it's exactly the same. When you talk to the drought people, they plan, prepare, it's almost the same things. But they kind of separate, they're different worlds. But the same concepts are in all these spaces. One of the big issues we have is that there's a whole emergency response system, which is completely, there's this nexus they talk about with the resilience building development piece. So there's a lot of bridges to build, I think. So anyway, that's all I wanted to say. But anyway,
I just want to say the last observation is that this is a very important topic, as Rachel mentioned. We would still convey this in a different forum, maybe in next year, to elevate this topic while CGIAR level drought action catalyst is emerging. I think this will be one of the critical theme area we would like to work with Nebraska, with the Jamil Observatory, so that it's needed a clear attention while monitoring and forecasting, you know, it's available in public domain. Now we can go and see in NOAA website, where is the rainfall deficit easily, but we cannot see the nutritional data easily. So this is some area where IMI and partners like you can work together going forward on that. Thank you so much. Let's have a cup of coffee. Otherwise, you know, we can all go there and have a coffee. Thank you again for joining with us in short notice.